Thank you, President Sampaio, Your Excellency Dr. Chan, honorable ministers. We members of civil society, particularly people who are infected and affected by and engaged in a fight against tuberculosis, who were presented at third Stop TB Partnership Partners Forum in Rio de Janeiro, Brazil, issued this declaration, which we called Rio Community Declarations, to call your urgent attention to the fact that despite being curable, tuberculosis continued to kill nearly 2 million people worldwide. Multi-drug resistant tuberculosis and extensively drug-resistant tuberculosis threatening to reverse gain which was made by National Tuberculosis and HIV/AIDS program. MDR-TB and XDR-TB are at rise and receiving inadequate or inappropriate responses.
As Mr. Bill Gates has said this morning, TB is well known the number one cause of death among people with AIDS, and I am a person living with AIDS, diagnosed 25 years ago, and actually I have the privilege to bring my physician with me, which is Dr. Margaret Olcomo, which is not a privilege of many. So, I actually am here because of this lady, but most of people with AIDS die without not even having a proper diagnosis. So actually, M and XDR represent a huge threat for people living with HIV and AIDS, and we actually require urgently new diagnostics, new treatment, and a new TB vaccine.
Rights-based responses are few, and the needs of the most marginalized groups of society continue to be unmet. Further, accessible and quality services and care for the most vulnerable and socially marginalized groups, such as including prisoners, drug users, migrant workers, refugees, are unavailable or extremely limited, as well as together with meaningful civil society participation in program development and policy research around the TB program is very low. Also, implementation of tuberculosis programs remains very weak, and participation of civil society is not meaningful.
Yeah, in light of these issues, we have completed the Communities Declaration, which was launched in Rio last week. And we have a message at the end of the declaration. We have a message actually addressed to you, honorable ministers, which touch a few points. And Tamari.
Yeah. First point is that we ask for to ensure that necessary diagnostic tests and treatments for drug-resistant tuberculosis are accessible everywhere where M and XDR-TB are found. And we ask to support the development of and ensure the access to new diagnostic tools that can be used as a point of care, treatment regimes that are proven effective in children and compatible with people with HIV/AIDS, and the new vaccines that will protect against all forms of tuberculosis and will be safe for people with HIV.
We have a global plan to stop TB. We have the Millennium Development Goals. We have to have TB controlled until 2015. And for that, we have to assure that this year we have guaranteed $44 billion to meet the development goals by 2015. Actually, besides this 44 million that we have to have assured this year, otherwise there will be more than 44 billion, we have to assure every year $2 extra billion for research and development of new tools, new vaccines, new drugs, new diagnostics. And we have to ensure that we have at least $270 million to improve the capacity of laboratories worldwide. Otherwise, we will never meet the Millennium Development Goals and we will not reach the targets of the global plan.
We ask as well to make community-based care for a multi-drug resistant tuberculosis, which has been shown to be to lead to better treatment outcomes, to be more effective, cost effective. And also we ask to facilitate to access to critical services as a norm in your national TB programs.
Well, and actually, as the Honorable Vice Premier Li Keqiang has mentioned this morning, I mean, we have to have those policies under the light of human rights. It's crucial that we address human rights issue, as we in the TB movement are mostly from the HIV and AIDS movement. We are based in human rights perspective. So we have to continue in this path and have assured that human rights issues are guaranteed. And when we address the question of mandatory hospitalization, sometimes this does not guarantee that people with MDR receive the best treatment. Not necessarily those hospitalized will receive the best treatment. What we have to guarantee is that each and every person with MDR are correctly treated. Otherwise, we will have a very serious problem very soon.
And we, as civil society representatives, want to be ensured that all TB patients, including the most marginalized of the society, are able to receive treatment that respects their human rights and ensures treatment success.
So we trust that you will be considering our points and our perspectives and our priorities in the issue of the ministerial call for action here in Beijing. And we thank the Chinese Ministry of Health, thank the presence of Dr. Chan and the Bill and Melinda Gates for their initiative to support the BRIC countries to put forward strong policies in TB. So thank you for your attention, and we count with you.
Thank you.